10:30, and it looks like we have the gang all here. I don't have any quick reminders to toss at you this morning, so I am going to turn it right on over to Val to get us going.
All right, thank you, Heike. Good morning, everyone. So just a lot of good news to report over the month of February, and I wanted to start with that. You know, we do keep track, thanks to everybody for reporting, but of cases in the community for individuals with developmental disabilities. We have had no new COVID cases reported of individuals in services since March 2nd. February was the lowest month for community cases at 89. We haven't been that low since June of last year when we had 21 cases. So far for the month of March, we've only had 3 cases reported. Total cases for individuals supported by the division is 1,793. Total deaths are 59. That number has also not gone up. We've had 260 providers who have supported an individual through COVID-19. So that's excellent news. I just got off the Fusion Cell call where our reproductive rate in the state is below 1. That's one of those factors that is really, really important when we are looking at resuming activities. So reproductive rate both and hospital admissions are going down. So lots of really, really, really good news. And access to vaccination will be increasing. So I wanted to talk about that next. Yesterday, Governor Parson announced an independent pharmacy rollout for vaccinations. Independent pharmacies will be getting 15% of the vaccinations. Right now, they've identified 161 pharmacies in 84 counties that will start getting access to that. Heike just posted in the chat a link to those participating pharmacies. When you open that, those are actually listed by highway patrol region, so it's not alphabetical and not necessarily intuitive. So please look through the entire list for your county and your pharmacies. Don't just give up on page 1. I know when I first started looking at it, I was like, oh, there's no pharmacies in Cole County. We were actually on one of the later pages, like page 6 or something. So take a look at that list. These pharmacies may be pharmacies that are close to you. They may be pharmacies that you as a provider, you as an individual, you as a family already have a relationship with. But please know you don't have to have a relationship with these pharmacies to get access to the vaccination. It's just an effort to get it as local as we can. And there'll be more pharmacies that get added to this list, so this is not an all-inclusive list of pharmacies. Thank you, Heike. So Heike is showing the first page is Region A, which is going to be the Kansas City Highway Patrol region. And then you can scroll through and see how it's by region, not really by county name or even by pharmacy name. But please take a look at that. These pharmacies, I don't think they will start getting doses next week. We're not sure what day they will start getting doses, but they should be getting about 200 doses a week. So we know a lot of folks can't manage a mass vaccination clinic. We know a lot of, again, in the spirit of meeting people where they're at when they are there. We know that we have employees that change their mind. This is just another tool for us to get folks access to vaccine, and at a much smaller scale, much more manageable, much more local scale. Also, just wanted to let you know that Walmart, Hy-Vee, Sam's Club, and Health Mart are all also doing vaccination clinics that are outside of these doses of vaccine. Ike is pulling up right now a registration process for Health Mart in St. Louis. They have an online registration process, so that's another tool to get access to vaccine for both individuals we support and for staff members. There was another question on the Johnson & Johnson vaccine and how that will be distributed. So the state got a first round of the Johnson & Johnson vaccine. That's already been distributed. Then we've been told we won't get any more for a couple of weeks. And so I know we're really trying to focus the Johnson & Johnson vaccine on places where individuals are not as captive of an audience because it is a single dose vaccine. And so that's going to be part of the focus around that, and we will, and we'll let you know more as we hear more about that. We don't have a ton of that back. We don't have a ton of that at this time, information on the J&J vaccine, but I do know the conversation really is about how do we get it into places where a single dose is going to be more meaningful in terms of a population of folks that we know we're going to struggle with getting to come back in to get that second dose or have somebody bring in to get that second dose. So good news on the vaccinations, access to vaccinations and expansion of the access to those vaccinations. Also good news on the J&J front, having that added to the arsenal is also really good news, and we'll continue to give you that information as we have it available. The next thing, with all of that, I think I'm marking stuff off my list because I'm not necessarily going in order. Another thing that we are excited, and I know that a survey went out last week, I think, maybe this week, I can't always remember, my dates we run together still. But BINAX, or that antigen rapid testing, is going to be made available for DV community providers, residents, staff. That has not been available in the past, and it's still not available on the open market. So you still can't just go out and order like BINAX antigen tests. There are requirements that providers have to follow if they want to access those BINAX tests, but you're going to be able to do so under a standing order with the state. So the requirement really is the reporting requirement. And you have to be trained before they will send them to you, and then you can get access to them, but you have to report all results, positive and negative results. So that was also exciting news, and glad to be a part of that rollout as well. Then, with all of that information, we're able to start talking about reopening and resuming activities. And so remember, everything that we talk about in terms of reopening is still very much person-centered. So one of the things that we are ready to resume is targeted case management in-person visits. And we are announcing today, and will continue with all of our other efforts, that we expect that everybody will have moved to face-to-face visits for targeted case management no later than April 1st, and you can do so sooner. Of course, there are lots of questions that come whenever we say that. So the first question, and we previously had the map that showed what counties were open and what counties were not open. So that map is still useful. It's just right now the intent is that all counties are open at this point. And by April 1st, those activities should resume. Now, remember, there are, we will, if we need to move counties back into the remote status, we will do that. That's very similar to the process that we followed over the summer, where counties would go on for 30 days and then come off. That doesn't change if we need it. Hopefully, we don't need to go back to that. Does this mean, I think another question we'll get is it expected to be in-person, open air, or in the home monitoring? I think you still need to be careful. So you absolutely still have to wear a mask. You absolutely should limit your amount of time inside and around people, because that's just standard practice across the world right now. But that doesn't mean that you can't go in and look around. That doesn't mean that if it's more comfortable to go sit outside after that and continue the visit, that's also an okay thing to do. You've got to look at this at a person-centered basis. Blanket statements never apply in our world, and they don't apply for this. Also, our provider is going to be able to review support coordination, planning, and monitoring in person. They cannot refuse, but we need to evaluate the situation. So we know that we are still going to have homes that are under quarantine for COVID. Don't be surprised if that happens, because staff will still be positive, because we may still have positive residents. So we know that there are going to be cases where you cannot get into the home for those kinds of reasons, but you have to look at this on a case-by-case basis. Clarification regarding if this TCM open up expectation includes all TCMs. Yes, all state staff and consumers. We base this decision on the positivity rate in the community and the positivity rate for the state and the reproductive rate of the virus. Vaccination has helped decrease those things, and that's why we are able to move forward. But vaccination is not, an individual's vaccination status is not the reason that we're doing this or not doing it. It is the case rates in the community, the reproductive rate of the virus overall. And we really do understand the value of masking and PPE, social distancing, all of those things should still be considered. Yes, I already answered that question. So I know that we will be rolling out all of this information on the various websites. So, but I did want to put it out here on this call as well. And then along with that comes resuming activities. So the department has been given some guidance from the CDC on how to resume activities in our state-operated rehabilitation centers, and we have begun planning what that looks like. So and again, this is planning, and it's on an individual level, and you can't, because I say this doesn't mean this works for everyone. So please don't forget early on, back in the summer when we talked about people accessing the community, all of that is coming back into play again, that there are responsible ways to do that. So one of the things that we are doing in our facilities is we are allowing individuals to access to communities if they are 15 days post-second vaccination. Of course, now there's Johnson & Johnson, so that just may be 15 days post-vaccination. But that includes attending church, going out to eat, shopping, seeing family, home visits. They must wear a mask at all times. They must social distance. They must wash their hands. They must avoid large crowds. So one of the things that we talk about here is if you know someone's leaving to go to a large family reunion or a large wedding, and we know that's going to be fully indoors, that's probably still not a responsible decision to make at this time for that individual, even if they're fully vaccinated, especially if that individual is going to come back and live in a home where there may be folks that aren't vaccinated. So you do need to look at all of those factors when you're making these kinds of decisions. Also, in terms of going to restaurants, we know some restaurants are really good at following COVID protocols, and we know some restaurants completely disregard COVID protocols. So take that into consideration when you're looking at what restaurants you want to go to. Also, how staff access our locations, we have started to change that. So for any staff we have that are fully vaccinated, we no longer require those staff to fill out the screening forms. We are still monitoring local positivity rates, so less than 3% in your community would be ideal. Less than 5% is still considered low positivity and is also good. But those are things that you can look at when you're trying to make decisions around staff and accessing the community. Also, we are starting to allow visitors on site. Access to the site and access to the individuals supported is going to be dependent on vaccination status in the facilities, and that's based on some guidance. So, and also we will still be screening any visitor that comes on site, and we will be implementing Binax testing for visitors. Now we haven't officially started doing more open visits. We are working towards that. We have been allowing visits that are social distance, like the screen in between them, outdoors. We've been doing that all along, but we're trying to figure out how to phase in those other kind of visits. So you definitely should be planning for resuming activities. And that, when I say planning, I mean planning at that individual level. And you should definitely be planning for case management to resume on a non-remote basis at this point. There is some more information, and there was a question in the chat that I'm going to look at. Accurate waitlist information for individuals waiting for our service. With feedback late last calendar year that slots would be available, and the governor's recommendation, hold on, it gets lost when I scroll down, in the budget, including funding for a number of waiver slots, we would like more accurate feedback. So right at this point in time, and I'm going to try to pull this up while I'm talking because I don't want to stumble over the numbers, we have what is in the budget today actually supports us eliminating the wait list at this point in time. We can't do it all at one time, although we will be reevaluating that in April to see if we can move more quickly. But at this time on the residential side, and I'm going to try, like I said, I'm going to try to pull up this, and Heike is, I think, going somewhere to pull up some wait. Yeah, go ahead, Heike, go to that wait list information page. So we do have this on our website. So there's the residential wait list and the in-home wait list. If you can go ahead and click on either one of those. And this is as of, there's a date, so as of March 1st, and just look at the 12 column, please, because we only support individuals with a score of 12 in the residential wait list. There are 147 individuals on the residential wait list. Now, next Monday, that's going to look a lot differently, and I believe we are posting this every week, I think, correct, Taika? This will look different because we do award slots at the beginning of the month, and we award, I believe, 26 residential slots per month at this time. So you will see this number look different next week. So the first of the month numbers really, especially if the first of the month on March 1st, a better idea of where we're at is if you look at the number on like next week. That'll be a better idea of where we're at. But we do 26, okay, I found my slide. We do 26 per month on the residential. Overall, we should be able this fiscal year to remove 194 individuals from the wait list. And then on the community support side, which she's gone to, there are currently 524 individuals on the community support wait list. And we are right now removing 90 per month. And there is no partnership or HOPE wait list at this time. So that continues to get addressed. And like I said, hopefully we can take a look at the number of individuals on the wait list as of April 1st, the number of dollars we still have available, and see if we can just fully open those wait lists. So that's information on that. Do the persons who want to go to the pharmacy, do they have to be in the current tier? Yes, yes. That's an excellent question. I'm glad you brought that up. They're still only going to vaccinate individuals that are in an activated tier. And that's, for us, really anybody who's under contract with the Department of Mental Health, so all of our providers, staff, and residents, all of the Division of Developmental Disabilities employees are in that tier, and then anybody with an intellectual and developmental disability, all of those tiers are activated. But that was an excellent question. I'm glad you brought that up. They are activating a new tier on March 17th. That's 1B Tier 3. That's really a lot of individuals that are kind of outside of our world, but that includes teachers, child care providers, telecommunication workers, electrical workers, other essential employees that have essential jobs that maybe aren't always directly in contact with people, but in very, very important positions. Someone can't hear. Yes. Okay. What PPE will be available to support coordinators? So you have access to order PPE. Highly, definitely should be wearing masks. You may want to be wearing double masks, but that is available. And you should be able to access that through your employer. I have set up ISPs for April. Can I keep these meetings as scheduled? We really need to start reviewing. That's an excellent question too, that you've set up ISPs for April already via WebEx. Can I keep these meetings as scheduled? We need to transition these meetings to in-person meetings at this time. So let's definitely work to get that done. Okay, there was a couple other questions that came in. Has there been, hold on. This is an excellent question. So has there been any update on the end of the declared national state of emergency? There has not been any update on that, although we have no reason to believe that things won't get extended. We fully believe they will, especially with all activity going on with the variants across the world at this point. Then the other question that I am going to address is, has there been any discussion about providers or others requiring as a condition of provision of service for a consumer to have the vaccine as a requirement for getting services? There has not been any discussion about that. If there is a requirement in the future, could there be some sort of appeals process for the person's due process? And that would definitely be something we would want to take under consideration if that is a requirement for participation in the future. So excellent questions, way to be thinking to the future. We're not there yet. The vaccine is still under emergency use authorization. So I think those are questions that we can look more to whenever we get closer to potential for places to be mandating vaccines. Also, and I'm going to say this again because I know I've said it a lot already today, but the vaccine gets us to a point of normalcy. And it keeps individuals safe, but we still have to be looking at those caseloads in our counties. We still have to be looking at that reproductive rate. We still have to be looking at that positivity rate. Those are the things that we're looking at whenever we're talking about reopening. Okay. So I am done now, and I am going to pass this ball over to Leslie.
Thanks, Val. Just some quick updates. The comprehensive and community support renewals, as well as the partnership and MOCID amendments to align with those renewals, are currently under review with CMS. The community support waiver amendment to increase Factor C or waiver slots from 4,500 to 4,800 is now being reviewed by MoHealthNet before it gets submitted to CMS as well. And we have a question from Thomas Waymeyer with County Connections in Troy. Is it true that the Schedule K and all the DD provider specific guidance will end effective 6 months after the end of the national state of emergency, or may some of the directives guidance be repealed, lifted sooner? So yes, Thomas, the Appendix K addendum will end no later than 6 months after the expiration of the PHE. And as you know, it was renewed in January 21st, 21. So it's effective 90 days, which is April 21st, 21. So the Appendix K, that 6-month mark would be, as of right now, October 18th of 2021. And that's all I have.
Thank you, Leslie. Okay, next up is Wendy. And Wendy, we cannot hear you. I see your lips moving, but I don't hear you.
Better?
Yes, absolutely.
Okay. I have one question here. I think that it was answered by Val in the course of hers is our, we are a TCM provider, and recently in a staff meeting, SDs indicated that there were provider teams that have indicated that they are ready to get back to in-home service monitoring. I understand we are currently remote, which we just announced that we're not remote anymore and can do open air visits. Is it acceptable if the teams agree that in-home service monitoring can be completed with the pre-screening tool being completed? So I'm going to answer this because we may have phases where we go back to a remote monitoring. And yes, if the providers and the TCMs agree on an in-person monitoring with the proper protocols in place and pre-screening, you can do the in-person monitoring, that just use the proper protections in place. There's also a question that came in from Thomas Waymeyer asking about Maccabees. And I am still sorting through information on the answer to that question. Thomas, I'm sorry I don't have the answer for you right now, but we will get it in our answers and also put it on the webinar answers for the next time around. That's really all I had, but there are some other questions in the chat, Val, that
there's
maybe
a lot,
we can...
Wendy, and Wendy, I can't address all these questions because the questions, a lot of times folks are typing questions into the chat at the time that I'm saying something, and so I cannot put all of these questions into context. That's okay. I'm not saying that that's where we need to be, but we will work on getting more guidance out there. It is March 5th. We are several days from April 1st, so work with us. I'm glad you put those questions in the chat. That's why we brought this up, and we will work on getting some FAQs out around case management and resuming case management. Generally, though, what I feel the theme of these questions is, what about families that say no? What about vaccination? Again, vaccination status is something that helps protect you, but what we look at are reproductive rates and positivity rates in the community. And so we are going to have to continue to educate folks around that. Another question is, are the regional offices reopening? We are in the process of working on that with our staff in terms of them being open to the public. That is another thing that we are working on. But the point that we are trying to make here is it is so important that we start seeing people face to face again, and we start seeing environment. We have a responsibility, and we need to start doing that again, and we believe we can do that again very safely at this point in time. So there is a lot of those type of questions in here, but those are the things that we look at to make these decisions, and we do believe you can do this very, very safely at this time. I know that we will take all of these questions out of the chat. This is another good question that I found. Is there any information on vaccine for children? Children are still not eligible under 16 to be vaccinated at this point. They are doing those trials at this time. I love this question too, and we will, and I'm going to bring this one up, except every time I roll my mouse, things like fall down, so I'm going to click so it doesn't do that. Will signatures still be able to be accepted electronically? And are we going to be updated COVID guidelines posted in writing? So that's also something that we are working on. And one of the things that we talked about as a group before, because we knew there would be a lot of questions coming into this call when we brought this up, which is why we did it, is what are the things that we have in place right now that we want to continue? So the good things that we've done during case management that have improved our process, we're going to try to figure out how to continue those things. Oh, go away. Repeat, what tier level for vaccination, Ms. Durius? Yes, I will. So currently, Missouri is under Tier 1B1, 1B2. On March 17th or 15th, I think, I have it written down, hold on. On March 15th, we will be moving to 1B Tier 3 for vaccination. So that will be the tier of vaccination that we are moving to on March 15th. That includes about 500,000 Missourians, including teachers, child care providers. So we've been starting to get questions around teachers. So the first question is, now that the second COVID mutation entering us and not tested positive on regular COVID, is that yes? The variants, we have lots of ways to detect variants in Missouri, and we are working on expanding those. Okay, and again, I am going to pass on the rest of these questions at this point in time, trying to see if there's anything not related to TCM reopening. Thank you for all these questions, though. That's, again, why we did it, so that we can hear from you. Trying to see if there's anything not related to that. Okay. Okay, these are all about case management. But again, remember, we're saying this because we think it's safe to re-enter the community, and we have a responsibility for the safety for the individuals that we support. So please, please, please remembering that. There's a question about Rcf Reopening Days. And again, we expect some guidance for nursing homes, additional guidance to come around nursing homes, skilled nursing, RCF, ICF. We kind of expected it this week. It hasn't come out yet. So we continue to wait for that. So the last thing we're going to do, and this is going to take, I think this video is about 10 minutes long, but I really hope that you stay on and watch this, and we will stay on and monitor the chat. But one of the things that is getting ready to happen in Missouri, actually on March 7th is when Missouri had its first recorded case of coronavirus, is anniversaries. And this whole, most of the time, when you have an anniversary for a disaster, you have an anniversary for a disaster because you had a tornado or you had a fire or you had, this anniversary is definitely different. So one of the things that we are really, really concerned about is how families, individuals, and members of our team, how all of that is going to impact folks across the next year, because this disaster is still going on and it's lasted over a year at this point. And so Becky Geer, who runs our Office of Disaster Services here, is a national trader around anniversaries and crisis counseling and preparing people for anniversaries. So we're going to show this video. I am not going to say anything more at the end of this video. Please, I understand if you can't even get through this, because this is hard, but we need to be thinking about how we support folks and be aware of potential warning signs and when people may need more help as these anniversaries approach. So we will keep monitoring the chat, so feel free to continue to put things in the chat. Please stick with us through this next 10 minutes. I think it's really, really important to see this and start thinking about how this affects your life, your job, your employees, your friends, your family. So thank you for everything you do, and thank you for sticking with us for the next 10 minutes. This will also be available if you like it and want to use it. We can get this to you separately as well. So thank you very much again, and stick with us.
Hello, my name is Becky Geer, and I work with the Missouri Department of Mental Health in the Office of Disaster Services. One of the things I've been doing over the past year is training crisis counseling teams all around the country, including right here in Missouri, on the FEMA and SAMHSA crisis counseling programs. One of the topics we train on is anniversaries, and in particular anniversaries associated with disasters. And with the anniversary of COVID, this is really a timely conversation that we can have. Before we jump into this presentation, though, I do want to take a minute to just pause and reflect on where we've been this past year and everything we've been through this past year. I also want to take this opportunity to thank you. Thank you for everything you've done. Thank you for everything you continue to do. This has been a hard year. And as we talk about the anniversary, this can bring up memories or thoughts that can be unpleasant. It's also important for each and every one of us to recognize that we are all in different places in this recovery journey. We all have different experiences with this pandemic, and many of these experiences may be negative and may not be associated with things we'd like to remember or think about. We also have other challenges or challenging events in our lives that may be part of this that have taken place over the last year as well. So because of that, I want to let you know that if you need to step away during this presentation or even turn it off, that is okay. I ask you to do what you need to do to take care of yourself. At the end of the presentation, I'm going to highlight some resources that are available, but I really want you to know that the Department of Mental Health is here to support you however we can. So we're going to take some moments together to really talk about what we need to be thinking about during this time, but also what we might be experiencing within ourselves or seeing within our staff and residents, or even family and friends. Anniversaries allow us this time to reflect on healing. It allows us time to think about what has happened over this past year. Anniversaries are also that time when individuals and communities come together to mourn those losses that have happened with this disaster. And every community does this differently. Every community in our state and even across the United States is going to decide on how or when or if they will observe the anniversary. So we're going to talk about what could be typical anniversary triggers, and dates could fall within there. So for Missouri, there's some dates you see on your screen here, and these are dates from our timeline in disaster services that we can pick out that may be something that stand out to you. So March 7th, we have our first case. March 13th, Governor Parson declares a state of emergency. March 14th, we start seeing more cases. March 15th, we start having schools announcing closures. March 18th, we have our first death in Missouri. March 23rd, we start to see some shelter-in-place orders. April 10th, we have a first death within our own community within the Department of Mental Health. And so it's important for us to remember that dates can look different for everyone. We all have different anniversary dates with this. It's not like that typical disaster when we have one impact date. This can definitely look different as we go through this event. Triggering events can occur at any time, and they usually follow that impact of a disaster. But again, we are not in this really typical disaster. So triggering events vary. They vary by the disaster itself, by the community, by the individual, and we know some events can be predicted. And we can predict that media is going to possibly be a triggering event because they are going to talk about where we have been in the last year. They might talk about the loss that we have endured. And so we know when these triggering events happen that time during the anniversary can increase the stress level within not only the individuals, but our communities as well. We also know there can be seasonal changes that remind survivors of the disaster. There are personal events like birthdays that might correspond with the disaster anniversary, or even just remembering what you were doing this time last year. Personal losses also might be associated with the disaster, thinking about what we have lost in this last year. Events we have lost, people we have lost, jobs we have lost, all of these could be an event. And these triggering events can change. They may increase in frequency around the disaster anniversary. They can occur unexpectedly. They're unique to each one of us. How I respond is going to be very different than how you respond. And they may not be something that we easily recognize within ourselves. So during the anniversary, we know we might see feelings and hear feelings of fear, sadness, and anxiety. People might start anticipating how this is going to look. And days, weeks, and months before this even happens, there can be a lot of fear and concern about how this event is going to make us feel and how we're going to respond to it. We also know that there's some typical individual reactions that we might see around the disaster anniversary. Individuals can experience those reoccurring thoughts or feelings or dreams and memories about the event. They might see repeated images and scenes associated with that event, or relive that event in their mind. There might be grief and sadness related to loss of income or job or loved one. There could be fear and anxiety that resurfaces around this time and leads to jumpiness and startled responses, and maybe even more about safety here. We also can see frustration and anger start happening more. People are being reminded about those losses, and that's not just the losses of a loved one, but this could be loss of time taken out of our lives, our frustrations with the recovery process, or how long it's taking us to heal. So we can see frustration and anger increasing. We also might see guilt about survival here. Some other individual reactions that we might see: avoidance. So some survivors try to completely avoid the reminder of the event or the day in of itself and treat it just like any other day. We might see some folks doing some remembrance activities, some commemoration or fellowship in the anniversary, honoring those we've lost. We also might see reflection, looking back on where we've come this past year, how we've overcome those challenges, the courage, the endurance it's taken, the resourcefulness that we have shown in the recovery process. And we also could see restlessness here. So that inability to really just hold still long enough to reduce the level of stress you have. And then complicated grief, and this can take many forms. So it's that state of just being overwhelmed by your emotions brought on by grief and loss. Gallows humor is another one. It's that type of humor that can arise from stressful or traumatic or life-threatening situations. So during anniversaries, we do see an increase in anxiety and depression. We see anger around the limited assistance or the system or the red tape. We might see increased substance use here. We also just may see stress about the lack of resources that are available or as resources run out. So speaking of resources, here are some on your screen. Show Me Hope is the crisis counseling program here in Missouri. It can offer free confidential help. It's being run statewide. Every person in this state is eligible for these services. You can find more information on the website. You can also call the Disaster Distress Helpline at 800-985-5990, and that is a great resource to call. They are available 24/7. You can find a trained crisis counselor there. You can also find more information on Show Me Hope Facebook and Twitter. We share lots of good information there. DMH Cares, which during the month of April and even in March, we're going to be running every Tuesday from 3:30 to 4, providing just 30 minutes to take out of your day to just step aside and do some self-care, some stress management, and do something that is a little bit different. We have some great resources on our DMH website there around stress management and self-care. And then, of course, it's always important to remember that the Missouri EAP, that Employee Assistance Program, it is a great resource for you. You can reach out to the Employee Assistance Programs through your organizations and set up services. They offer all sorts of different services. Please, please, please reach out if you need assistance. It is very common to need assistance during these uncommon situations that we are in. So know that we are here to support you at the Department of Mental Health. Thank you. Hello, my name is Becky Gear, and I work with the Missouri Department of Mental Health in the Office of Disaster Services.